All right, so today is, I believe it's Saturday. I've just about lost track of time because haven't really been able to drive. The surgery was on Tuesday on my right eye, and this has been highly frustrating. If you look at the first video that I made, I was in tears. I was so frustrated. And that was a month or two ago. And I can tell you this, as I sit here, I'm in the most frustrating phase of the entire process. Because my right eye can see distance but not close. My left eye basically can't see anything, but once you get up to within about 6 inches, 3 to 6 inches, everything focuses up real nice, which the implant eye does not do. So it's very okay. So basically, first I take my glasses here and I pop one of the lenses out. So then I'm trying that. The problem with this is then it corrects the other eye. Okay, but it makes everything appear on one side as if it's about 2 feet away from, say, the pictures you're seeing are about 2 feet away from one another. So there's zero depth perception. So it was almost better just to have one good eye and then one bad eye. So I haven't been doing this for the last 48 hours. It's frustrating with all this eye stuff. So then I went over to Kroger. Okay, so I got me a pair of these. These are readers. Never had these before. All right. So then these, well, a reader is basically just a magnifier. It's a magnifying glass. So then when I get about 2 feet away, everything comes into focus on this side, on the new side, and I can do my work on the phone, on the computer. But it's frustrating because a lot happens within, between your eye and about 3 feet. You do a lot, and you multitask. You go back and forth a lot. So these readers are very frustrating. I'm not interested. Okay. And of course, at this moment, in order to do that, I'm having to close this eye to get that effect, which then hurts my brain. It hurts it like this because since both eyes are different, looking out of these readers works for one, but not the other. Then when I close my eye, it just hurts my head because I'm having to strain to keep that one closed while I'm using this one. My head is killing me. All right, so at this moment, what I did is I went ahead and I put a contact back in this eye right here. So right as I sit here, both of my eyes can see. It's a little bit different on both sides, but they can both see. However, on the new side, I can't see close up, but on the contact side, I can now because the contact corrects everything. Which then has me wonder, so I've been doing some homework. I need to understand if I'm going to be able to correct the vision on the new side with contacts, because I am not interested in these things right here. I have too much to do to be going back and forth. I'm sorry. Everybody tells me, you'll get used to it. Everybody does it. I'm like, I don't care what you'll get used to, and I don't care what everybody does. I got too much stuff going on up here and down here to be fiddling around with this crap. And so I'm not interested. All right. So I need to make sure that I can correct that part of this vision with a contact. Because if I can't, then I'm going to question whether I should have the operation over here. because I can possibly continue to correct this with a contact. Now, that may seem crazy, but keep in mind, although I have terrible vision over here, I do not have a cataract. And by going and having the operation, I am choosing to remove the lens in my eye that I know exactly how it works and I know exactly how to use it. So I can make it function. But this one over here, which I've had for a couple of days, I do not know if I can do that. I'm hoping I can. And I've been doing some homework and it would appear that I can. But you know how that is. You never know until you do it. And I certainly can't do it on this one for probably several months, I would think. And also there's a possibility of getting Lasik to correct the near vision, which I'll do. Now that I've gone down the road of doing this, I'm willing to do just about anything to get back to normal. Because this is killing my head. So at this moment, although I appear to be in tears again, maybe, it's not quite as emotional as it was in the beginning. It really, like it is that it is wearing me out. So it's more physical, but it's wearing me out. It's something that is non-physical that's wearing me out, but it's wearing me out physically. I mean, my temples, man, they feel like they're just bulging. Okay, so anyway, I may appear to be frustrated at this moment, but I really am not. Because the cataract is gone in the right eye. But it's interesting, and it's interesting to put the contact back in the left eye. And basically, the contact corrects everything. The contact allows my eye to see everything, close up and far away. And that is magnificent. So the right eye, in comparison to the contact, the new implant is great. And it gives me something I've never had before, but it doesn't correct everything like the contact does. So the contact, I pop it in, and 1 second later, I'm like, man, everything is corrected. But with the implant, the long vision does appear to be corrected. However, it obviously takes a while for the lens to start to grow into the eye. Because it does seem like things change maybe a little bit. Alright, so I don't want to bore anyone, but I thought someone might be able to get some help if I were to discuss this a little bit. Okay, so once again, at the moment, I've got a contact in the non-operative eye, and so that one is totally corrected. I have a new interocular lens, which is a what's it called? It's a mono lens. It is not a multifocal, it is a monofocal lens. So it's a monofocal interocular lens. What that means is that the lens I've had implanted will only allow me to see distance but not up close. They also make what's called a multifocal interocular lens, okay? But here's the deal. I've done some homework on that, and I should have done it beforehand, but you know what? A lot of times you don't know what homework to do before you've had something done. So it's kind of interesting that I'm having this done twice. So I have it done once, then I do some homework, and actually I decided that I've made the right choice. The multifocal, not only more people have problems with it, seeing halos and not able to see as well, and they have a higher instance of people requesting an exchange, meaning that they ask to exchange the multifocal for the monofocal. but apparently no one asked for the exchange going the other direction once they have the monofocal and then the corrective lenses, corrective glasses or contacts. But the biggest thing is, which I didn't know, is that the multifocal lenses decrease contrast sensitivity. Okay, so apparently if you get the multifocal lenses, you don't see the contrast as well. Meaning, and here's the definition of contrast, and I know all this, and this is important to me because I'm a critical viewer. Here's what that means. It means that I will buy and sell televisions based on how good their picture quality is, so that I can literally watch content as perfect as you can get it. So I'm not watching the movie, I'm watching the actual content, what per pixel. Watching the actual contrast, meaning the difference between the darkest area of the screen and the lightest area of the screen. So apparently with the multifocal lens, you lose sensitivity to the darkest and lightest areas. And that is not going to be something someone like me is going to like. So apparently a monofocal lens gives you better contrast sensitivity. And I've watched some pretty good, very graphic type movies, meaning that, not meaning they're graphic violence, but like I watched the Lego movie, which is very graphic. Lots of contrast, lots of colors, and it looked really good out of my right eye. So, which is the new lens. All right, so you need to be aware of those things when you're going to go get this surgery done, because number one, insurance is paying for this. So you can't do the way I do a project, which is typically it's going to be put the lens in, see if it works. If it doesn't, pull it out, put another one in, pull it out, put another one in, and it's surgery. You can't really do that, but apparently you can do an exchange. So don't just go into the cataract surgery with no information, just based on what the doctor tells you. Because the doctor may be in a hurry and they may not tell you everything that you need to know. And one thing that I was considering is I've still got a week, but a little over a week before the next surgery, is that I may go and see an optometrist and just kind of get them to look at everything and tell me what they think I can do to correct the implant eye, so that I know what I'll be able to do when I do the next eye. So anyway, that's a lot of talk, but there's a lot to consider. So sorry, I haven't really been able to clean up much because I don't want to get any soap in my right eye. So all right, that's it. So as I sit here, I mean, I can see it's different, and I don't know how my eyeballs actually look on the video. Man, they feel all squirrely. So I don't know, man, if I'm looking all cross-eyed, I don't know. But I guess I guess I'll upload the video and I'll check it out. So, all right. And I would cross my eyes on purpose just to be funny, but good Lord, I'd hate to do that and have the implant screw up, because I can cross my eyes really hard on purpose, but I'm not going to do it. I'll do it later. Bye.